Hey everybody, and welcome to today's video broadcast. Happy Friday to you. Sorry I'm getting it off a little bit late today, but I've been running back and forth getting therapists scheduled into the clinic and introduced into the clinic, and we just interviewed 2 more therapists and brought them on, massage therapists. So we now have weekend hours. We have Saturday and Sunday hours available for massage therapy. So for those of you who are not members of the massage membership club, call us and get your initial massage for $49 for an hour massage, and then we'll go over the details of the membership program with you to where you can actually get your massages in the future for $39 an hour. It's an exciting program, a lot of convenience, and a lot of hours available for people to get in there and get the services. But today I wanted to talk about a study that I came across that was talking about how TENS units were not effective for chronic back pain. And this is not the first study that I've come across that says this. There have been several studies that had shown evidence that electrical stimulation was not something that that provided long-term relief for pain syndromes. And in this article right here, it was dated December 30th of 2009, and they're talking about how transcutaneous electrical nerve stimulation is not effective for chronic low back pain, and that the studies did not work around acute low back pain, so they didn't know whether it was effective for acute low back pain, but they were saying that it was not effective for chronic low back pain. So what's my opinion on this? Well, it's kind of a mixed opinion. I've never really felt like the electrical stimulation, even the stuff that we use in the office, was long-term beneficial or used for long-term benefit. In my opinion, it's always been used more for pain management. And the theory behind the TENS unit, which is the home unit. Now, TENS unit's a little square stimulator that you get, and you can take it home with you, and then you can put the pads in the area of the pain, and then it gives you an electrical impulse through those pads to help reduce the pain. And the theory behind it is what they call the gate theory of pain, and this is one of the mechanisms that they think that makes this work. And basically the theory is that the electrical impulse travels up the nerve to the brain quicker than the pain impulse. So once the electrical impulse gets into the brain and triggers the sensation, then the pain impulse can't get in there, so it reduces the pain. So, you know, that it's a good theory, and you know, I've gotten mixed results from patients. Some patients really, really love their TENS units, and they say that it really helps them. Some patients say it doesn't really have an effect. My opinion is, again, I think it's good for short-term relief. I think that, you know, if you're aching and you're hurting and your muscles are tight and you're just trying to get some relief, it's a good thing to do. I just don't think it's going to give you long-term fix. The only thing that's going to actually get in there and fix the problem is, you know, rehabbing the musculature and, you know, getting the pressure off the nerves and allowing the body to get back to its proper biomechanics through the chiropractic adjustments, through the massage therapy, and the active rehab and exercises that we do at the office. That's the best way to get in there and fix these things long term. But for short-term relief, I don't think a TENS unit is a bad option, just as long as you understand that it's not a permanent option. Now, what's the difference between this small TENS unit and what we use at the office? Now, the office has a higher electrical impulse, and many of you who have experienced and have experienced, when we turn the dial up, you can feel your muscles actually contracting. And what that is that's the electrical impulse penetrating into the muscle and triggering the muscle fibers to contract. So what we do is we can actually constrict and release those muscle fibers, increase blood flow to the area, and fatigue the muscles. So spasms are actually fatigue their way out. It also, because we're increasing blood flow to the area, we can reduce the inflammation chemicals and get rid of some of the pain chemicals that are in the body. Again, I don't think these are long-term fixes. I don't think you can come in and sit on our TENS unit, our electrical stimulation unit, and heal yourself. It's more of a short-term pain management protocol. In fact, sometimes people can actually become addicted to these therapies because the body is not rehabbing itself, it's not healing itself, and so therefore the therapy itself providing relief, the body kind of becomes dependent and wants that to try to get the relief. So we use the electrical stimulation, especially with decompression patients, especially with people that are just starting rehab, because we're trying to maintain an even keel on the pain level and on the soreness level, but we're not using it necessarily to heal. It's a pain relief mechanism. Now, cold laser, on the other hand, that little laser that you guys have seen me use in the office, that actually does speed the healing process, and that does show long-term effects for musculoskeletal healing. So that's why I like to use that with patients to get down to the cellular level to speed the healing process with what we're doing with the adjustments and with everything that we're doing in the office. So just a little bit of information for you. Do I think you should throw your TENS units away? Absolutely not. If it works for you, keep on using it. But don't let that be your only protocol. Get in there, get the adjustments, get the nerve pressure, get the biomechanics restored to your spine, give your body the opportunity to function the way it should so it can heal properly, and then you don't need these things at all. All right, I hope everybody has a great weekend. As always, my hope for you is that you can take control of your health before your health takes control of you. And please, please always remember that here at Massage Membership Clubs and at Chiro Spa, we've all got your back. All right, you take care. Bye-bye.